Now it's the time for case scenario. Mrs. Brown is a 70 years old lady who presents to outpatient clinic with complaint of fever for around 1 month, which is most of the time low grade and associated with fatigue, generalized weakness, and body aches and pains. She is having headache since 1 week, which is particularly in temporal area. She states that although she used to have headache once in a while before, but this is different. She never experienced this type of headache before. It is so uncomfortable for her to wear glasses or even to comb her hair. Apart from this, Mrs. Brown noticed an unusual symptom that her jaw hurts while chewing. This is especially when she tries to chew harder food like meat. Even these symptoms appear when she tries to speak for a longer period of time. And most importantly, she experienced 2 episodes of loss of vision, which was sudden and painless. She felt like a curtain dropping in front of her eyes. Each of these episodes lasted for less than 5 minutes and resolved all by itself. Before all these symptoms, she was experiencing a healthy and active life without much significance in her medical history. On examination, she had a blood pressure of 130/80, pulse 106 per minute. She is febrile with a temperature of 100 degrees Fahrenheit. She was found to have tenderness in temporal area and an artery could be palpated near temples. Her full eye examination was performed, during which optic disc edema was found during ophthalmoscopy. Some routine lab tests were ordered and results of which are hemoglobin 10.8 gram per deciliter, WBC is 5,600 per ml, platelets 400,000 per ml, and ESR was 90. Now can you tell me what is next step in workup of this patient? Temporal artery biopsy of Mrs. Brown was urgently arranged on the basis of her complaints, and she was admitted and started on intravenous steroids before even the result of biopsy was available. The dose was 1000 mg per day for 3 days. Later, oral steroids at the dose of 80 mg per day were started. The result of biopsy showed disruption of internal elastic lamina, invasion and necrosis of media by mononuclear infiltrate, and giant cell formation with granulomata. Mrs. Brown showed a dramatic improvement in all her symptoms, including vision, headache, jaw claudication, and fever. She was sent home with oral steroids and a close follow-up was booked. So this case scenario gives you a message that always think of giant cell arteritis in new and unusual headache in elderly people. And secondly, try to screen visual symptoms and start steroids immediately. As with timely management, it's a completely treatable condition and can save elderly population from morbidity and a miserable life due to blindness.